Hello, I'm Dr. Pizzadili, and welcome to my series on happy outcomes for cancer patients. Case number 41, prostate cancer. These cases come from the book, One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelly, written by Dr. Nicholas J. Gonzalez, completed in 1987 and published in 2010 by New Spring Press. The research was supervised and the cases were verified by Dr. Robert A. Good, who was the former director of Memorial Sloan Kettering Cancer Center in New York City, one of the oldest and largest cancer research and treatment facilities in the world. Patient 41 had prostate cancer. Now, he was an 83-year-old male, and he died after surviving 9 years with widely metastatic carcinoma. Going back to the beginning, he was in excellent health until early 1978. He got symptoms of partial urinary tract obstruction. He eventually consulted his family physician, where they noted an enlarged prostate. In May 1978, he was admitted to Des Moines General Hospital. A bone scan and X-ray revealed abnormalities in the 8th thoracic vertebrae consistent with metastatic disease. The patient had transurethral resection of the prostate, and tissue specimens confirmed grade 2 adenocarcinoma. The patient agreed to a course of synthetic estrogen called stilbestrol. And in fall of '78, a follow-up bone scan showed metastasis had not improved. His medical doctors then recommended orchiectomy, that's castration, followed by radiation and aggressive chemotherapy. The patient refused all further conventional care, believing himself too old for such an assault. November of '78, he decided to investigate alternatives. He learned of Dr. Kelly, he consulted with him, and began Dr. Kelly's program of nutrition, detoxification, and pancreatic enzymes. And he discontinued the stilbestrol. Within months, all the symptoms resolved. After 1 year on the program, and against Dr. Kelly's advice, the patient strayed from the prescribed diet and supplements. He did well for a time. Then in early 1980, he developed chronic abdominal pain and urinary tract obstruction. February 1980, the patient was readmitted to Des Moines General Hospital for reevaluation. Lab results showed elevated acid phosphatase level, indicating active prostate cancer. A repeat bone scan revealed new lesions in the thoracic spine. Quote, increased activity may represent either trauma or metastasis. We know where that's going. Patient number 41 had a second transurethral prostate resection. The surgeon discovered the tumor had extended beyond the prostatic capsule into surrounding tissues. All biopsy specimens were positive for cancer. After surgery, patient 41 again refused orchiectomy, radiation, and chemotherapy. He did agree to restart the oral stilbestrol, but in February 1980, after discharge from the hospital, he resumed the full Kelly program. 6 months later, he discontinued the hormone therapy, the stilbestrol. So patient 41 followed the Kelly program for another 6 years, during which he enjoyed excellent health. A series of X-rays and bone scans confirmed gradual healing of the metastatic lesions, the cancer that was spreading throughout his skeleton. Now, patient 41 unfortunately stopped the program in mid-1986, and within several months, his disease recurred, and he died in February '87. Dr. Kelly believed that he never should have discontinued the nutritional program. We must realize that prostatic carcinoma, once metastatic to bone, is deadly and kills quickly. Even with aggressive treatment, normal median survival is only 45.6 weeks. That's less than a year, and this comes from the textbooks. Now, while he did also use stilbestrol, the synthetic hormone, this therapy is not shown to prolong life. So patient number 41 had a deadly prostate cancer that should have killed him in less than a year. And his prolonged 9-year disease-free survival and high quality of life is remarkable and directly attributable to Dr. Kelly's diet, detoxification, and enzyme program. Amazing outcome. Here we see how under conventional cancer treatment, the patient faced pain, misery, and certain death. Then they chose a non-toxic alternative and got a much different outcome. Their health was restored, and they lived and enjoyed life far beyond all predictions. We must remember, the cancer industry is focused on shrinking tumors and not on restoring health. We know that conventional cancer treatment is risky. Chemotherapy and radiation themselves cause cancer. Surgery and biopsy spread cancer by releasing circulating tumor cells. So instead of all that, we work together with you to restore health so that your body rids itself of cancer. Now it's time to think about the people who love you, the people who depend on you, the people who want you around, and how important you are, and ask yourself, are you doing everything possible to recover your health? To optimize health and defeat cancer, we must establish 6 fundamentals. Number 1, we need an optimal body pH. That's the acid-alkaline balance. Your body pH must be in the right zone in order for digestion, immune system, and all other biochemistry to work properly. We must balance hormones. We're in an epidemic of hormone-related cancers. Breast cancer, uterine cancer, ovarian cancer, prostate cancer, testicular cancer. Well, Dr. Kelly wrote that he felt that it was excess estrogen that triggers all cancers. We must detoxify the body, mind, and emotions. We're in daily exposure to thousands of toxic chemicals that were not around 100 years ago. And most of us carry toxic thought and emotional patterns that block healing. Detoxifying all 3 is critically important for every cancer patient. We must eliminate infections. Now, cancer often shows up when the body is exhausted from fighting chronic infection and inflammation. For example, the leading cause of liver cancer is chronic hepatitis C. Now, you may have chronic and untreated infections that you don't even know about. We must rejuvenate depleted organs, glands, and systems. The biggest single risk factor for cancer is aging. And folks, that means everybody that's 40 and up. Over time, our body is depleted of essential nutrients and enzymes so that normal systems break down and chronic disease and cancer take hold. Then we must use the best proven cancer-fighting natural methods. There are natural methods that are proven to turn off and kill cancer cells. And we work together and determine which ones work best for you. Unfortunately, chemotherapy and radiation make all those important health factors worse. Not good. So we come back to this. I'm not going to be your MD or your oncologist. Those treatment decisions about chemo, radiation, surgery, Those are between you and the prescribing doctor. But I will work together with you to restore health so that your body heals itself. These patients in my Happy Outcome series, they had the courage to take their fate into their own hands. They did so in spite of opposition from MDs and in some cases opposition from their families. And they enjoyed recovery and health completely outside anything seen in conventional cancer care. Ask yourself again, are you doing everything possible to recover your health? Then call my office, 907-272-6299, and make an appointment. I look forward to seeing you, and I look forward to changing your life for the better. Thank you. I'm Dr. Pizzadili.